Good morning and welcome to the Crossroads for Hope Coffee Chat. My name is Katie Hill and I am the Development Manager in charge of corporate relationships at Crossroads for Hope and the moderator for the event this morning. Thank you for joining us for our casual bring your own coffee chat about the cancer experience in the workplace. Before we begin, there are just a couple of housekeeping notes. First, please be aware that this webinar is being recorded. While you are not seen or heard, your questions may be visible, and this will be a panel discussion. The Q&A box is open, and we encourage you to ask questions of the panelists, and we will answer them at the end of the presentation. And to get us started, I am pleased to introduce the main moderator for our discussion today, Brian Kane. Brian is a pharmaceutical company professional. He is a Crossroads for Hope member of the Board of Trustees, and he is chair of our Pharma Biotech Task Force, which is hosting this event. Welcome, Brian.
Thanks, Katie. Hey, welcome everyone. Thanks for being here on this beautiful fall morning. Last night was the first night we turned the heat on, and we actually needed it. So thanks for being here. Welcome to the call. Crossroads for Hope Network, formerly known as the Cancer Support Community of Central New Jersey, embraces all touched by cancer, the diagnosed, and their loved ones, empowering individuals through access to resources, as well as programs of support, education, well-being, and hope, trying to take on the cancer journey together. We never charge individuals for our services. Thank you. Thanks to the generosity of our donors. This morning, we'll hear from two leaders in the oncology space in New Jersey, Dr. Kathleen Toomey and Crossroads for Hope Program Director, Katherine Schaible. First, let me share with you how I decided to spend my time advocating on behalf of Crossroads for Hope and volunteering my time to lead this group. I have a professional career, a lifetime working in oncology in pharmaceutical and biotech companies, in the commercial operations space, and analytics, and data and market research. When I was an incredibly young sales rep, I asked the doctor, what will happen to this patient? And he said, the patient's gonna die without treatment. Literally at that moment, it hit me just how urgent and critical our work is. Often while watching market research, cancer patients, listening to their stories, I would cry. I would hear their helplessness. It's not just about the diagnosis, it's about the entire patient's ecosystem. Their family, their friends, all share the burden of the disease. Family members feel helpless. Each time I listened to the oncology patients in focus groups, common themes emerged. Patients, families want hope. They want a chance. They want a chance to go on with their lives. Partnering with Crossroads for Hope is a vehicle to help patients and their families and caregivers on a deeper level. It's about the people, the patients behind the glass. Even though we don't know their name, we just want to bring them hope. That's what Crossroads for Hope does for me. Now I'm going to introduce my friend, good friend, and colleague on the board, Trustees, Jack. Jack McCallie is an oncology leader at Merck and also leads the nutrition committee for Crossroads for Hope. Jack, all yours.
Thanks, Brian, and good morning, everyone, and thanks for being here. Thanks for taking the time from your day to talk to us. Like Brian, I've had a lifetime in this business. In fact, this week marks the start of my 5th decade in the pharmaceutical industry. So once I was a young pup, but today a little bit grayer in the hair. But still, the focus, the passion, the compassion for these patients. I've started in working in oncology back in the late 1980s, and I saw the despair, the angst. And Brian actually was the gentleman who brought me into Crossroads for Hope and the mission. One of the things that I've seen over my years is that folks need a place to turn to. They don't know where to turn. And while the internet is a lovely thing, it can also be a dangerous thing. And folks, patients, their caregivers, they need to know that they have the ability to be in control. They feel that this is something outside of their control with this diagnosis. They need a safe place. They need a place to understand, to talk, to listen, and to learn, to get the tools to help to manage and cope through this. As Brian said, they're looking for hope. They want that one more day. And while on the day side, we tried to do that to provide more tomorrows, the reality is we can't do it alone. And we need the support of organizations like Crossroads for Hope to help us. I took on the nutrition committee chairmanship because food is something that's incredibly important to all of us beyond just the nutritional value, but something that we can do to control. Patients and their caregivers can control the types of food they eat to understand the good foods that are out there. And we are working very diligently now to build a program around nutrition, not just a software program, but also a building where we will have a kitchen. And within that kitchen, we will teach good eating habits with the nutritionists and some chefs that we've made contacts with. So I'm here today to speak about how we can help patients have more tomorrows, to live through. We've all had patients and family members who have passed from cancer, and it's a devastating thing. But one thing that I hear continuously, and I talk to physicians, is that, and to patients, is the thankfulness that they have for their caregivers, for the physicians, for the folks at Crossroads for Hope, that they were able to help provide a little bit of sunshine, a little bit of calm in the storm that is managing and thriving through their cancer therapies. So with that, Katie, I'm going to kick it back to you. And thanks all again for being here. And we look forward to having a nice dialogue with you this morning and further on beyond just today.
Thank you, Jack. I'm going to let Brian take it away with introducing our two panelists and starting that discussion. You're still muted, sir.
I hate when that happens. I had it on mute, apologize. Thanks, Katie, thanks, Jack. Dr. Kathleen Toomey is a member of the Crossroads for Hope Board of Trustees with a long history with us. She served as the first chairperson of the Crossroads for Hope Professional Advisory Board for over 10 years. Currently, she's the Regional Director of Oncology Services at RW Somerset, RWJ Hamilton Central Region, attending mental oncologist with an academic appointment at the Rutgers Cancer Institute of New Jersey. Her practice is cancer and blood specialist at the Steeplechase Cancer Center, where she's been a medical director since 2007. She did her training in medicine, medical oncology, and hematology at St. Peter's University and the RWJ University Hospital in New Brunswick. Her Bachelor of Science was from the State University of New York at Stony Brook, and medical degree was from the University of Bologna, Italy. Welcome, Kathy.
Thank you, Brian.
Great, thanks. Katherine Schaible is a licensed social worker. As a program director at Crossroads for Hope, Katherine is responsible for the daily operations of Crossroads for Hope's comprehensive program of support. She leads an interdisciplinary team of social work, child life, and public health professionals delivering psychosocial support and resource navigation for people and families affected by cancer. Katherine holds a Bachelor of Arts in Social Work from Siena College and a Master's in Social Work from Boston University, with a specialization in group dynamics and trauma-informed practice. Prior to joining Crossroads for Hope, Ms. Schaible lived in Ecuador, where she co-founded and operated an after-school program for abused and neglected children. She draws on this expertise every day at Crossroads for Hope in her role managing outreach efforts to diverse and vulnerable communities as the point of contact for members. Welcome, Katherine.
Thanks, Brian.
Dr. Toomey, let me start with you, if that's okay.
Sure.
When a person is first diagnosed with cancer, what effects can that have on a person's ability to do their job, to do work?
Yeah, so preparing for this discussion, I realized that every person's journey is different, and every person's diagnosis and treatment are different, and how they might respond or not is different. So patients do really need to know what they're going to be able to do and what they're not going to be able to do. So it really depends on the diagnosis and what the treatment regimen is. So in general, chemotherapy is tougher than radiation, but sometimes that's not true. Sometimes the opposite is true. You could think of somebody thinking, Jack, about nutrition, think of somebody with a head and neck cancer, and the chemotherapy helps the radiation to work. So it's not so much the chemotherapy, but the radiation effect on the esophagus and being able to swallow and being able to eat, and nutrition. So nutrition is always important for our patients. Or you could think of someone who has a leukemia or a lymphoma and they need something all the way to allogeneic bone marrow transplant. So it depends on the patient, but most patients do want to know, what am I going to be able to do? Can I work, for example? So it's hard to know ahead of time. You know, I always tell my patients, wow, you went through it pretty easily. And other patients, wow, we finally got you through. So everybody's journey is absolutely different.
Great, thanks. Katherine, do you want to chime in there or some point of view?
Well, I think just to piggyback that, I think to Dr. Toomey's point, you know, with everyone's treatment plan being so unique and different, then that drives a very unique emotional response. And so for the context of this conversation, when we talk about survivorship or cancer survivors today, that term is so loosely utilized more now than ever, because it really depends on how the person identifies along their own continuum of care. But I just wanted to just bring in some research here. I was also doing some digging around what survivorship even means today. And so the National Coalition of Cancer Survivorship defines a survivor as anyone who was diagnosed with cancer from the point of diagnosis through the rest of his or her life. And that piece of it to me is so critical, because that could mean somebody who's living with the disease, who's going through active treatment. It could be post-treatment, right? Looking back and reflecting on what they've endured, or through end of life, if that's the path that their cancer takes. And that the number of survivors by this definition is increasing rapidly today, to the point where we are near 15 million cancer survivors by this definition in the United States. So with all of these medical advancements, which I'm sure Dr. Toomey can speak to, right, especially in the development of more effective treatments, targeted therapies, where it allows the increase of these numbers of cancer patients to live longer lives and more fulfilled lives. Really kind of turning, like I'm reflecting on Brian and Jack's introductions on your work, 5 decades ago, and the stories that you were hearing, where the big C is still a big C when you're given the diagnosis today, but those once incurable cancers are now chronic conditions that people are living their daily lives with.
Yeah. I mean, you think about what you just said, that progression's been made in treatments. However, it's still such a large part when someone hears that diagnosis.
Right.
And maybe when we think about treatments, on first surface, we think, oh, treatments are good. They can help patients. They can help our loved ones. And this is really like a two-part question. First, on the medical side, Dr. Toomey, what might be the side effects of some of those medical treatments? And then Katherine, what might the emotional effects be, or the emotional side effects of those treatments? Maybe start with Dr. Toomey.
Sure. So, there are side effects that people think about, and there are side effects that happen, I think the doctors think about more. So patients, what do they worry about? They worry about hair loss, right? They worry about nausea and vomiting. We're pretty good these days at preventing nausea and vomiting. There's such things as cold caps, for example, to help avoid hair loss. The doctors are worrying about the blood counts and infection and those kinds of problems. But I think one of the biggest side effects that might affect people, especially at work, is fatigue. And what am I able to do? What am I able to do today? Am I taking extra naps? And do I have to go to bed early? Can I just get home and then have dinner and go to bed? I have no other life. So it's, I think fatigue is probably one of the toughest side effects. And we try to fight that with, advising people to continue to exercise and keep as active as possible. And, but the fatigue is of different types, right? The fatigue can be physical, but it also can be psychologic fatigue. And, the fatigue of terror, the fatigue of depression, the fatigue of worrying what tomorrow will bring. So, in terms of side effects of treatment, once again, they're myriad, but I think the underlying fatigue is the one that really affect what happens to people.
Thanks.
From an emotional perspective, I think what it's important to realize is that every single one of those physical effects has a correlation to the mind and the emotional ability to cope with those changes in the body and what's going on. I think also often when people refer to side effects from cancer or the treatment, the stereotype goes to the physical changes, when really distress in and of itself is the most common side effect of cancer. Anyone who's impacted by cancer is going to experience some degree of distress. And it's underreported. People don't talk about it because it's such a private experience. But the thing is that distress can really range from, it just has a wide range of experiences, from the daily fear or worry or anger or vulnerability, all the way to a more clinical or more severe diagnosis of depression and anxiety or panic that would require, potentially the intervention of a medication or psychosocial intervention. If distress goes unaddressed, like if the cancer goes unaddressed, the symptoms will increase, and there will have a decrease in terms of the impact of quality of life. However, the good news is that my job is around empowering people to really leverage the tools and resources within their ecosystem to manage the distress. So it is treatable, it's manageable, but it really is a parallel process that coincides with the cancer treatment itself.
Interesting, thanks. I have a series of questions that would relate to, quote, cancer in the workplace, when a colleague, an employee, a manager might get cancer. So I want to go through some of those questions, and then maybe after that, Katie, you can see if there's any questions in the chat. And again, these are two-sided questions, one on the medical side and one on the psychosocial side. So maybe we can start with, what happens when an employee is diagnosed, and then what do they go through when they're deciding to disclose that diagnosis? Do they have to disclose it? What are the reasons, concerns they might have on the medical side, and what might be some on the psychosocial side to make that difficult choice? Maybe you can start this time with Katherine.
Sure. So the thing is when someone's newly diagnosed, employment really is one of the greatest concerns, because the reality is, most people are dependent on their job or their workplace for their health insurance coverage, right? That's a huge logistical piece. But for many of us, especially in today's age in corporate America, work is intimately attached to our sense of identity and pride and purpose. So making that decision is really huge, because it's just as large of a component or important component of our lives as family might be, or other, sort of psychosocial realms. So I always say that the collaboration between the patient and their healthcare provider or healthcare team and their manager is critically important, because as patients are learning about all of the ways that treatment is expected to impact their daily routines, if work is a priority, then their healthcare provider can help them with making educated treatment-related decisions that can ultimately benefit their health and also potentially protect their job if that's possible. So, Dr. Toomey, I'd be curious to know from your perspective what it is that you're telling patients when the workplace becomes such a priority.
So patients, the first thing they say is, can I work?
Right.
And all I can say is people do. So, so yes, you can work and it's possible, and others have, and, maybe choosing the day of your treatment to be a Friday, for example. What the workplace needs to know is that there certainly are time constraints. There are, going to the infusion area, getting my treatment, what will be the side effects, when will I be recovered, working with that. And we do have patients who absolutely, I have, the gamut, people who are amazingly supported and people who are amazingly not supported. I think the main thing for the workplace is that realize that this person is going to have a lot of things that they're going to have to do, get scans, go for testing, see the doctors, get their treatments. Radiation therapy is Monday through Friday for a period of weeks. In radiation departments, they try to help those who are working to come early or come late. I have teachers, right? My teachers come after 3, right? I have lots of teachers. It depends on the job. I mean, and it's terrible to see a patient who's not supported at work, and it's wonderful to see a patient who is supported at work. So my, best advice is support that person, be very concrete in your support, and certainly let them know that we're waiting for you to get better and we're waiting for you to come back to 100%, whatever that might be. But for now, we are here for you and we support you.
Great. I have an incredibly meaty question. I'm looking at the clock. I'm so appreciative of people being on the call today. So maybe I think we can wedge one in quickly. So how can a manager, employer, be a partner in the patient and their healthcare team? How might that happen? Either Katherine or Kathleen, either one who wants to try to jump in first.
I have some thoughts. One is this is assuming that a patient is deciding to work and disclosing that they have cancer in the workplace. So I think a manager or whoever the leadership team is, the first thing that they can do is really just educate themselves on the information that they're being given. So just we know that in general, cancer is disturbing and worrisome. So, and we've all heard about cancer, but we want to make sure that you know exactly what it means and what it means for that patient. So seeking out that education for yourself as a manager and the teams that you expect this employee to be working with is one good way. And then, coming up with a mutual plan of, a supportive plan that's going to entail reasonable accommodations, talking about who the point of contact could be in terms of communication should something happen that the patient can relay information to, so that they're not, taking up the whole staff meeting to update on their health status. And then really just creating a culture that supports, to your point, Brian. I mean, just, including the employee in normal meetings and social activities and calling to action any outside resources like Crossroads for Hope, for example. We can come in and entertain a dialogue on the impact that this cancer diagnosis has on the work, the general work environment.
Great, thanks. Kathleen, do you want to, Kathy, do you want to?
So no, yeah, no, I agree. I think I've had a recent patient whose manager came in with her. That's not the usual case, but she was obviously very supportive. And so being supportive in any way that you can. I mean, people might need help to get to an appointment, they might not be able to drive themselves, for example, or somebody might need some help at home, whatever it is, the support is that this is not your fault. We understand that you didn't choose to have this. We are here for you. Your job will be here for you. And I think that those kinds of things really help the patient in their journey.
Great.
I want to add to this too, because I mean, we're talking about a lot here, right? There's the logistics medically, there's the emotional impact, but then there's a lot of practical needs that come out of cancer in the workplace. And so I think just without a doubt, it's really important to turn to the HR department and pull out that old like employee handbook and policy procedure manual, because there's a lot that's in there that actually protect the rights of a cancer patient from a legal perspective, in terms of, disability benefits and all of those employee assistance programs that are part of the benefits package that employees have. So I think that's just a really good baseline place to turn to in order to prepare for these types of conversations with your employees.
Thanks for really informed answers. Katherine, I'm going to ask you a very quick question. Sorry, it's not a quick question, but I'm asking, I'm going to put you on the spot for a incredibly quick answer because of the clock.
Sure.
There's a really good question that came in the chat, and the question is about do we see, because of people working at home, has stress lessened? And I'm sure you could go on for that for a long, long time, but you've got about 30 seconds.
Sure. I don't think stress is lessened at all, but it has to do with the reason why we're working from home. We're working from home in a global pandemic, and that's increasing distress across the board for everybody. But it does raise an interesting question, because telecommuting or working remotely has often been the number one reasonable accommodation that an employee would request. And now that that's sort of normalized, it's prompting employees to think more creatively about those other work demands and things that entail working with cancer that could also be an accommodation that they could benefit from. I hope that answers the question.
Yeah, it does. Thanks. And I'm just seeing the comment in the chat, and thank you, Stacy, for your comment, and sorry to read that. And that's literally the emotion we all feel when we learn about a friend, a family, or loved one. So sorry about that. Maybe what I can do is ask Katherine to follow up, or Katie to follow up, and Stacy, if you want to provide some contact information, that would be great. Sorry, literally, this is what happens when we learn, and so hopefully we're able to help you. We really appreciate your time today, everyone. We know you have busy schedules, and we're here. We're here to help you. We're here to help your family. We're here to help loved ones. Please reach out if you think there's things we can do. We're here, and genuine thank you to Dr. Toomey. Oops, we're off.
No, I'm here. We're still here. I just wanted to flash up our contact information on the screen. If you personally need some assistance, as one of our attendees did, there's contact information here. If you and your company or managers or HR department is looking for a way to partner and learn even more detail than you could learn in a 30-minute chat, we're here. We are looking for ways to reach our communities, and we see businesses and employers as another concentric circle of the community. So please don't be shy. And Brian and Jack, I just want to thank you for representing Crossroads for Hope and centering patients in your jobs and also in your volunteerism. Dr. Toomey and Katherine, thank you for sharing your expertise with all of us this morning, and for all that you do to increase hope for those affected by cancer. And thanks for everybody who was able to join us this morning. We hope that you were able to learn more about the effects of a cancer diagnosis in the workplace and how Crossroads for Hope can partner with all of you to support your employees. And please reach out and don't hesitate to contact me to discuss next steps, and have a wonderful rest of your day. Thanks, everybody.